Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course,
Good posture,
Bob.
Brad. Good posture.
Posture.
Today, Brad, we're going to talk about sacroiliac pain, everything you need to know to cure it. We're going to we're going to talk about the anatomy, the causes, and then we're going to show you the exercises.
Yeah, this is the whole cornucopia, Bob. This is going to bring it all in. This is going to bring it all into one picture, and you're going to have a good educational experience and have some success.
All right. Yes, sir.
Okay.
If you are new to our channel, please take a second to subscribe to us. Please don't make us beg. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also,
but we will beg.
We will beg. If you want us to beg, we will. Also, please go over to Facebook and like us so we don't have to beg. So, all right,
okay.
Let's talk about some anatomy.
Sacroiliac. I distinctly remember as a child, my mother would use the term sacroiliac. And I don't know if she really knew what it meant. I certainly didn't. I just thought it was kind of a neat term.
Yeah, a lot of people use it, I think, as I got sacroiliac pain because I have back pain.
Right.
A lot of times that's where it is.
Right. So let's talk about where it is exactly. Here we've got Leopold, their skeleton, but that's not where it is. We're talking about down here in the sacrum. And then, so that's the sacral part, sacroiliac. This is known as the ilium, this part of the pelvis, this big paddle-shaped bone. So it's the joint right between the sacrum and the ilium, sacroiliac joint.
So the sacrum is a triangle-shaped bone, and there's a joint that it forms right with the ilium.
Right. So you've got two SI joints, one on the right, one on the left.
Yep.
Okay. Now, can you zoom in on this close, Lonnie? Don't get Bob's face in there because we don't want to lose viewers.
I'm out.
Okay. So if you look right here, now this joint is not like an elbow joint or a hip joint. It's really quite solid. Okay, and there's actually some debate. Does it actually move or not? And that goes to the PhD level.
Right.
But we're going to assume that there is some motion in there.
Slight motion.
Slight. I mean, this is probably more than it would be.
It's got heavy ligaments that cover it up, so
it's minimal, but it doesn't take much to produce pain.
Right.
So what we want to do is if this gets shifted like this, we want to eventually...
Or it can shift back,
right,
and we have to shift it forward.
There you go.
Either way.
It's going to rotate one way or another typically, and there's lots of PhDs discussing that.
So if we show it from this side, what he's saying is sometimes it gets rotated forward that way, and sometimes it gets rotated back that way.
Right.
So.
All right, so that pretty much covers the anatomy, Bob. Should we go on any further?
No, let's keep going. All right, what are some of the causes, Brad?
All right, a common cause, like if you're walking across and there's a curb or a sudden step down and you get that force going through your hip and that can jolt that SI joint and get it out of place. That's one, or you're jumping off of like maybe the back of a pickup truck down. Anytime you get that sudden jerk,
especially if it's 1 foot,
right,
versus 2 feet landing at the same time.
Exactly. Trauma, I've had people that are in a car accidents where they go forward and their knee goes into the dashboard and it puts a good jolt on that SI joint.
Sure, that would do it.
A common one is women who are pregnant because of the joint, the ligaments get lax because of the hormones.
Right.
And that's a little bit different, but this still could be used with
Another one, Brad, is just sitting uneven.
Sure.
So a lot of people sit, on one side more than the other.
Yeah.
Or they cross their leg all the way at the same time, and that just puts a little bit of uneven pressure.
Yep.
And if you do that year after year, it can certainly cause things to be a little bit out of kilter.
Right.
That's why we always talk about try to balance.
Right. Posture, be upright.
And if you do something one way for a long time, it's good to correct it and maybe go the other way for a while. So.
Okay.
You got 3
symptoms.
tests, Brad?
What are common symptoms?
Sure.
How do you know if this is not back pain versus SI joint pain?
It can be hard to tell.
It can be.
Yeah.
But some common things that we found over time is typically SI joint pain will be in the back, the hip area, one side usually, not always across.
Usually one-sided
right?
versus two-sided.
The pain typically, it will refer down but not past the knee. If you've got pain all the way down in the foot, probably not SI, probably from the back here, which is interesting. But that's a typical thing.
I've seen pain in the groin from SI, although I see pain in the groin from a hip too, so it's a hard one to rule out.
Right.
But I think the pain with weight bearing is a common one, right?
Right, because when you're walking, you're putting weight, and if you remember what we talked about, how that SI joint moves, every time you walk, it can irritate that and get it to shift a little bit, up and down, steps, walking, or sometimes just standing and weight shifting.
The problem is, though, you can get pain with weight bearing with a hip problem, too, so that's why it almost takes a therapist to diagnose it. But we're going to show a couple tests you could try, right?
Sure, you bet.
So, you want to show the first one, Brad?
Do that now?
Yeah.
Okay.
Let's go work. Keep working, buddy. Keep working.
Keep the video flowing. I had a couple
grinding.
comments that we babble on too much in our videos, Bob. I don't know.
Hard to believe, isn't it?
Okay, so if you lay down flat, supine, and not in a bed, better on a carpeted floor or a firm mat, a firm surface like this, and we do the figure 4. So your ankle goes above the kneecap, right on your thigh, and then you let this knee drop down, and then we can put a little overpressure.
Yeah, and like as a therapist, I actually put my hand on his pelvis and here, and I do it that way
Right.
to get a little cranking on there. But you could do it yourself
Right.
to see if it brings it
So
on.
I'm going to support here and here, and it doesn't take much pressure. So even Bob, as a therapist, he's gently
Yeah.
pushing here. It's just a little bit. You got a lot
So
of
again,
leverage.
he formed the number 4.
Right.
Formed 4. That's hard to say.
Yeah, we better get on with this
All
video.
right.
Okay, so we do this. Now what you're looking for is the pain that you are experiencing that's bothering you. Now this could create a pain in the hip that
Right.
from a different source, but we're looking at the pain that you're
Does it
wondering about.
recreate your pain,
Right.
the pain that you've been worried about?
If you go, oh God, that feels just like the pain that I'm bothering me, then you know you're right.
And you can do it on both sides.
Yep.
You can do it just real quickly.
Yep.
And then what's the next one, Brad?
Compare one side to the other.
Okay.
Thank you. Oh, the
single
next
knee
one.
to chest.
Yep. I like to do this one. This one you could do on a bed, where you're going to let this leg come off.
Make sure you don't fall off. You
Right.
see, keep the shoulders way on.
Right. So I'm
And-
here. I'm being safe, and now I'm going to pull this, and that's going to put a little torsion, rotation on those SI joints. And if I do this, and I feel that same pain that we're trying to get rid of, and I pull, it's like, oh, that is the same pain, and you do that, then you know you
It's a
don't know.
possibility.
It's a very good possibility that is a SI pain.
And again, you'll want to do it on both sides. You don't need to show up, Brad, but you'll want to test both sides. You'll have to
Right.
swing around to do
Yeah,
it.
you bet.
All right, and then the last one, Brad, is just a real simple test here where you're going to have to need somebody else to help you out here. And they're going to put their hand right about where the belt is, because that's usually where the ilium is. And they're going to push on this. And if that recreates your pain in the back here, this thing really shouldn't hurt back pain.
Right.
This would be something that would be pretty specific for a sacroiliac problem.
Sure.
So
And Bob's not pushing real hard. It's just a gentle, firm pressure. Now, if you have a positive test on all 3 of these, it's indicated that it may be it's stronger indication that it is SI. Not 100%, but stronger. The more that are positive, the more indication it is. Now, the big thing is go right to the treatments. And the treatment, when you do it, we got 3 of them, that my favorite ones, and I think Bob likes these as well.
Sure.
When you do these, it should reduce the pain while you're doing it, and then when you're done, it should feel better as well for the
Right.
next hour or 2.
Double bonus.
Right. Okay.
so
You ready, Bob?
yeah, let's go.
This is one of my. I call it. This is what I call.
I'm gonna get these out of the way.
I learned this one in PT school and been doing it ever since, and been supported by some continued ed courses. But say that my right side's affected, I'm going to bring my right knee up. I'm going to grab my knee here around and support it with my arms real strong, and I'm going to do an isometric push this direction. It's called a muscle energy technique in the therapy world.
So yes, he's pushing. If his arm wasn't there, the leg would actually go that way.
Yeah.
So,
So I'm gonna restrict that motion, lock that knee in, and I'm gonna push. And it doesn't have to be pushed as hard as you can, but you're gonna put pressure on there. And while you're doing it, it's like, oh, that feels kind of good. And when you get done, it's like, oh, that feels good. And then you're gonna repeat that 3 to 5 times. And if you get positive results, it feels good. You're gonna do that every hour. And it won't be too long, and your pains are gonna be gone, and you
now
won't
it's
have to do it.
possible, like if the pain is on this side and that doesn't feel better, you might try it on the other side.
Right. Yep.
Yeah, this side might actually make this side feel better.
Yep.
So you want to try it on both sides, because it's depending on which way your sacrum, your ilium needs to be turned.
Right.
So-
Exactly. Okay.
All right, next one, Brad. You want a pillow?
Yeah, I want a pillow.
Sorry. Sorry for getting in the way.
There we go. So now you don't need a pillow. If you got carpeted floor, it's not necessary, but this is a hard linoleum floor and it's or tile, I mean. I want to protect my knee. Now I'm going to stretch it. I'm going to be up tall like this, not over like this, and then I'm going to bring this hip forward, and that's going to rotate that pelvis in this direction as you see my hand going. You can put your hand back here and push, and again, just like I mentioned, it should feel good while you're doing it, Bob. It's like, oh boy, that feels like the right direction. It feels like a good stretch. This one doesn't work for me because I know I've got some SI issues, and
It doesn't help.
I have some. The next one is my favorite. That works great for me. If I throw it out when I go for a walk or a run, and
And again, you can do it on both
yeah,
sides.
both legs. Again, I'm not going to do it because of a time issue.
Stool?
I like a stool now.
okay.
At home, I actually do it on my stairs outside because it's the right height. But I need something about this height, and I'll put my foot up on there. And so you know, if you're going to do this, you have to be stable. You know, either something to hold on to or feel very stable. You should feel relaxed while you're doing this. If you feel like your balance is off, don't even try it. You should be very stable. I'm going to use this for some balance here, and I'm just going to drop down. And even right now, this feels great for me. I do this stretch just because it feels good. But when I do have some back pain, I'll do this. It feels better while I'm doing it, and I can walk around, and it feels better.
I've never seen that one before, Brad. I learned something today too. This looks like a good one. I was just going through
So
my
it's
head.
really, it's
Yeah, it's
bringing
turning it.
right.
And quite often, that is the way it needs to be turned.
Right,
And,
yep.
So sometimes it needs to go the other way, but
Yeah,
then again, you might be, again, sometimes if the pain's over on this side, it actually might help to do it on this side.
Right,
I mean, on the opposite side, because it's which way it needs to be turned.
So there you go. That's it. I said this is the cornucopia. This is it in a nutshell. This is what we have to present. So good luck with your SI pain, and I think it's going to work well.
Thanks for watching.